Hello, thank you for joining us. My name is Dr. Ruth Slack, and I'm the director of the University of Ottawa Brain and Mind Research Institute. And I'd like to welcome you to our interactive webinar series entitled Dementia Prevention: The Power for Change is in Your Hands. And this series is sponsored by the University of Ottawa Brain and Mind Research Institute. And what we do at the Institute is we bring together the top researchers from across the entire city of Ottawa to focus on developing new treatments for neurological disorders. So this means bringing together scientists that work in the research laboratories, making new discoveries, who work together with clinicians in the hospitals that see patients, who work with patient groups, community groups, and our top trainees to focus on discovering new treatments for devastating neurological disorders. And one of the greatest challenges of our times is to find an effective treatment for dementia. And right now in Canada, the number of people with dementia is increasing rapidly, and still at this point there is no cure. But there is some good news out there. We know that many forms of dementia can be prevented, and other forms can be significantly delayed by making healthy lifestyle choices. So the goal of this webinar series is to spread the word that dementia has the potential to be preventable by just making healthy lifestyle choices. So it's a real pleasure now to introduce our keynote speaker today. And this is Dr. Antoine Hakim, who is a neurologist at the Ottawa Hospital. He's a senior scientist emeritus at the Ottawa Hospital Research Institute and professor at the University of Ottawa. He's the founding CEO and scientific director of the Canadian Stroke Network. And the Canadian Stroke Network completely transformed patient care and changed the lives of stroke survivors, not only in Canada, but also worldwide. And for this work, he received numerous awards, including the Order of Canada, also the prestigious Gardner-Whiteman Awards, and he's also written a book entitled Save Your Mind: 7 Rules to Avoid Dementia. So it's a real pleasure to turn the series now over to Dr. Antoine Hakim, and I really hope you enjoy it.
Thank you, Dr. Slack, for this wonderful introduction, and it is my pleasure to share with you information and advice about a big problem that is impacting many individuals and society in general. We're going to talk today about dementia. There is 1 million Canadians today who are suffering from a problem that impacts their memory functions. And this figure is growing by 1 person every 5 minutes. And so in about 10 years from now, there will be 2.4 million Canadians who are suffering from a problem with memory function. And 15% of these individuals will be young people under the age of 65. The risk for dementia at the age of 45 is 20% for women and 10% for men. And 70% of patients with dementia, therefore, are women. And here's the scary figure. In 10 years from now, the cost of managing dementia at that time will exceed our entire current healthcare budget. This is going to be a major burden on our national budget. So what are we talking about when we talk about dementia? Is there such a thing as normal forgetfulness? Absolutely. When you went to the fridge looking for something, and by the time you got to the fridge, you couldn't remember what that thing was, that doesn't mean you've become demented. It just means you've got a busy mind and a busy schedule. And so if you just stand by the fridge for a few seconds, you will remember exactly what it was you came there for. And so there is such a thing as normal forgetfulness, and we shouldn't panic when it happens to us. If it gets a bit worse than that, so you run into someone, you know them, and you can't come up with the name until they are gone and past you, and you then the name comes to you. That's maybe called mild cognitive impairment. There is just a bit of a problem with the immediacy of memory, and there are memory lapses that are occurring, but they are not interfering with your ability to function. It's when your colleague at work or your neighbor comes up to you and says, John, what's going on lately? You don't seem to be remembering things. Or your boss comes to you and starts making a comment about how your memory difficulties are interfering with your efficiency at work. That's when and we begin to reach the diagnosis of significant cognitive impairment. And when that gets to be serious, it's called dementia. Dementia is an umbrella term. It describes all kinds of conditions that lead to deterioration in mental functions. And the important message I want to give to you is that to protect yourself from this, you cannot wait till the problem starts. You have to be way ahead of it and protect your brain against dementia, basically from the teenage years all the way forward. We have to try to protect the brain from the eventual appearance of cognitive impairment. And so until recently, we used to think that Alzheimer's disease accounted for 2/3 of the cases of dementia. And our thinking process, the science, has moved beyond that in ways that I will explain to you. Let's just ask, what is Alzheimer's disease? Here is a slide that shows in a normal hippocampus. It's a part of the brain that is very involved in memory function. And when you look at a normal hippocampus, you can hardly see it. It's there, but a normal hippocampus is not visible under the microscope. When you look at a patient who has what we have now been calling Alzheimer's disease, you can see that the hippocampus is a little more obvious. And that is that it's got some accumulated little spots, which we call plaques and tangles, that are seen in higher magnification in the lower slide. These are proteins that have accumulated in the slides, and these proteins, until recently, we thought were the cause of Alzheimer's disease. And it was an important conclusion because there is really no cure for any type of dementia. There are drugs available that take care of the symptoms, but they do not tackle the underlying disease. We thought that the underlying disease were these proteins that had accumulated in the cells of the brain. So drug companies have spent billions of dollars testing drugs that remove these proteins that are in the plaques and tangles. And they did so successfully. They removed the proteins from the brain, and it turns out that that has no benefit to the patient and does not improve the patient's cognitive challenges. So this forced a rethink of what we now call Alzheimer's disease. The proteins are there, and they are evidence for Alzheimer's disease, but they're not the cause of Alzheimer's disease. How did we get to really doubt this rule that these proteins were the cause of Alzheimer's disease? There was a major study amongst many other indicators that the proteins are not the problem. The presence of cerebrovascular disease was looked at in 5,715 cases that had been diagnosed with Alzheimer's disease when they were alive. And so when they came to autopsy, 5,715 cases were looked at in detail. And the conclusion was that almost 80% of these patients who died with the diagnosis of Alzheimer's disease showed a vascular abnormality. There had been a problem at the vascular level in the blood vessels of these individuals. And so we now recognize that vascular risk factors are an important, perhaps predominant cause of dementia. Any condition that reduces blood supply to the brain will cause trouble with memory. Here is a recent study that was published by my colleagues in Montreal, in which they did an amazing correlation between how the brain functions, what its metabolism is like, and correlated that with the cognitive problems. They started with HC, healthy controls. They then looked at early mild cognitive impairment. They then looked at late mild cognitive impairment. And in the same patients, they looked at late onset Alzheimer's disease load. And as these individuals were progressing from completely normal function to Alzheimer's disease, they did repeated measurements of blood flow in the blood flow that comes to the brain metabolism, vascular supply, and all of these proteins that accumulate in the brain that we have been describing and talking about so far. And their conclusion was amazing. The very first thing that goes wrong with the brain that then triggers all of the other changes, including the accumulation of these proteins in the brain, the very first thing that goes wrong is that blood flow to the brain goes down, decreases. If there is a decrease in the blood supply to the brain, all hell breaks loose, and eventually there is going to be a problem with memory function. Why is that? Well, here is a picture that highlights all of the blood vessels that feed every part of the body. And the redder the organ is, the more blood is coming to it. Look at how the brain lights up. It only weighs 2% of your body weight, but consumes 20% of its energy. Each brain contains 600 kilometers of blood vessels and capillaries, and it is entirely dependent on its blood supply. Whether you are walking, or you are talking, or you are sleeping, or you are eating, your brain is working for you. And so it absolutely requires energy supply at all times. Any decline in cerebral blood flow is a trigger for dementia. And so people have looked at this very carefully, and we are very grateful to Debbie Barnes, who in 2011 said, what are the factors that contribute to dementia? And look at the figures that apply to us in North America. She said, if you have low education, there is a 7% chance that that will bring on dementia later on. The brain wants to be constantly stimulated with information, put it to work. The axiom that you use it or you lose it applies to your brain. And so low education was a factor that contributed to dementia in 7% of cases. In 11% of cases, smoking was associated with dementia. If we sit on our butts and we don't move and we don't exercise and we don't remain active, 21% of dementia is due to physical inactivity. That's the contribution of physical inactivity. Depression contributes to 15% of dementias in North America. High blood pressure contributes to dementia, diabetes, and obesity. And these are the factors that in fact led me to think, okay, we can put down some rules that say, if you avoid these things and if you do these other things, you will protect yourself from dementia as you get older. And so I am happy to share with you the information that for most of us, dementia is a consequence of vascular disease. And this implies that we can control a major part of how we age. It turns out that these proteins that accumulate in the brain that form the plaques and tangles are not the disease. They are a consequence of the disease. The disease being that there is reduced blood flow to the brain. When that happens, there is not only a reduction in the supply of energy to the brain, but the brain also doesn't get washed out, and these proteins then begin to accumulate in the brain. And so we will together learn about the things we need to do to protect our brain from a decline in blood supply so that we can protect ourselves from this condition called dementia. Thank you very, very much.
So I'd like to thank Dr. Hakim for a very interesting and informative webinar, and I hope everyone really enjoyed it. And at this point, I would like to thank our supporters and also acknowledge our partners. So the University of Ottawa Brain and Mind Research Institute is affiliated with and supported by the University of Ottawa and the associated faculties. We also have over 250 researchers, many of whom come from our partner institutions, including BHAW, the Briere Hospital, the Montfort Hospital, the Ottawa Hospital, and the Royal Institute of Mental Health Research. Finally, I would like to thank the Brain and Mind admin team for all the work and all their production efforts, including Natasha Hollywood, Victoria Rache, Candice Fortier, and Sarah Schock. So thank you so much. And finally, if you have questions for us, or if you have comments, or you'd like to follow us, please go to our website at uottawa.ca/brain, or follow us on Facebook or on Twitter. And many of you are with us today because you have lived experience with dementia. Like many of us, you have family members, friends, or relatives that are living with the devastating effects of dementia. And presently, there is no cure. So if you would like to make a difference and make a direct impact on the innovative research that we're doing at the University of Ottawa Brain and Mind Research Institute, please support our memory and cognition research today by going to the link alumni.uottawa.ca/brainhealth. So thank you for being with us, and we hope you join us again soon for upcoming webinars.